he doesn't really have the ability to deliver oxygen to the tissues like normal people do because of the blood flow issue. So they're going to have to work on simple things that he took for granted 10 years ago.
Welcome to the Nick Ferg Show, and today I am joined by Doctor Jesse Morse. He is a sports physician with several years in Major League Baseball. He served on several medical staffs with the Blue Jays, the Phillies, and the Marlins, and I'm happy to have him today. Dr. Morse, the biggest story coming out of Colorado is Coach Prime and his issues with blood clots. So could you explain that for the audience?
Sure. So, unfortunately, blood clots are quite common. Usually when we think of them, it is almost like a gelatinous-like material that happens usually in the calf, behind the calf as a DVT. You associate them with long car rides, plane rides, and then sometimes they can travel and head into the lungs, which causes a PE or a pulmonary embolus, which kind of blocks the blood flow or air, depending on what we're blocking, to the area. Now, Dion's is a little bit different. His is actually to the artery, which is significantly more concerning and much, much rarer. That does not usually happen on regular people, day-to-day stuff. This is usually more genetic linked. I'm not a vascular surgeon, but I understand enough about these intricacies of what's going on. And it sounds like he found out last year when he ended up having the initial toe injury and toe surgery, that his mother had dealt with significant blood clotting issues, and several of his uncles did as well. So he wasn't aware of these blood clotting issues. He's probably got one of a couple different syndromes that prevent him from having normal blood flow. And for whatever reason, the blood clots a lot easier than other people, than regular people. So the trauma in the lack of movement during a surgery on purpose ended up causing a significant kind of like a car accident, kind of a backup of blood in the artery. So the artery is what brings the blood flow from the heart to the tissue. This is delivering all the oxygen, all the nutrients. So you're stopping all of that, and the tissues after the blood clot don't get any blood flow, especially if it's to an important artery. So that's essentially what happened the first time about a year-ish ago. He had multiple blood clots in kind of the artery that was kind of below his knee, from what we heard. He had 3 different blood clots that were basically preventing blood flow from the heart to the foot. And after surgery, you need blood flow to heal things. And unfortunately, he wasn't getting blood flow. So it sounds like he probably had a dislocated second toe, which is actually what Michael Thomas had last year. The surgery should have been straightforward if he didn't have this vascular issue. He then likely developed a combination of side effects and issues where the blood stopped flowing. It then caused the blood clot, but it also caused an inflammation of the vessel inside of the calf, known as compartment syndrome, which is a significant concern in a medical orthopedic emergency because the blood flow to the entire foot or most of the foot stops. So you basically have to cut open the entire calf, like fillet, literally, to open up the pressure and relieve the pressure on the nerve and on the blood vessels. So that's why if you ever see his leg, he has a huge scar on it, and that's why, because he had this huge fasciotomy, and he needed a skin graft and a bunch of other crazy stuff. So this is not your regular blood clot. Unfortunately, this is significantly more complicated. That unfortunately is probably going to be lifelong in some capacity.
Now, with Coach Sanders now living here in Denver, Colorado, where you have high altitude, how, if at all, that impacts how he deals with this injury moving forward?
So that's a good question. The issue Dean is going to have to face is he's going to have to be on at least 1, if not 2, blood anticoagulant meds. Your Plavix, your aspirins, that type of things, but that's always going to put him at increased risk for bleeding if he has trauma or anything like that. But when you add travel, the data shows, and the majority of the travel is for venous thromboses, because those are the much more common in the veins. The data shows after 10 hours of travel is when the significant increased risk starts. They also looked into the pressure changes, the hypobaric pressure changes, and they thought that may lead to some problems, but it doesn't seem to have any really good evidence to prove that. So I'm sure they're going to do what they can to make sure he doesn't have any clots at the time. And if he does have some that don't move, so when he does travel, or if he's allowed to travel, that that it doesn't obviously cause new problems.
So the team is going to have to travel from place to place. So what's going to be on the minds of the medical staff and how they have to deal with this and help him in his day-to-day activities?
Yeah, I mean, it's going to be challenging. He's going to need, almost a personal physician, so to speak, or at least a member of the staff that's directly responsible for him, that can travel with him, that is understanding of his situation, that can make sure that, check things, make sure pulses are fine. Maybe he grabs a Doppler ultrasound to show you, hey, blood flow is moving, and just checking in on him while he's traveling. Being in a big conference now, he is going to have to travel, and it's going to require flights because it's not exactly up the street. So I think it would be counterproductive if he had to drive, because then you're really adding length to the trip. It's just not realistic to travel 10, 15, 20 hours to a location and turn around and do it again when you can hop on a flight for 2 or 3. So I think they probably thought of this, at least I hope they did, before they signed him. Because this is going to be a significant, I won't say burden, but cost, in at least coordination and clearance, definitely.
How does this impact his life kind of long term?
Yeah. So the problem with this is because it's genetically linked, and actually there's an interesting thing where as we get older, we actually clot easier. The amount of clotting factors in our blood increases with each decade. So as he gets older, he's going to increase his risk of clotting, which is the opposite of ideally what you'd want. So they're gonna, he's gonna have to be very cognizant of what he feels. If he senses anything changes, any numbness, any tingling, any cold feelings, any pain, he was probably dealing with some weird pain in his groin, which is what led to this recent hospitalization, I'm assuming. But everything is going to have to be monitored very closely. He's going to make sure his blood levels are fine, making sure his blood thinners are appropriate. This is going to have to be kept close because it doesn't take a whole lot for him to clot, unfortunately.
There's always rehab that's associated with any type of injury, surgery. And when it comes to blood clots and having them in both left and right thigh, what's going to be the rehab once he has the surgery?
Yeah, so obviously this isn't a specific injury to a ligament or a tendon or something that is specific and direct, but he doesn't really have the ability to deliver oxygen to the tissues like normal people do because of the blood flow issue. So they're going to have to work on simple things that he took for granted 10 years ago, just to make sure that he can continue to provide, strength and sustain that muscle, or grow new muscle if possible, to be able to, tolerate that. I know he rides around in a Segway a lot of the times because he probably doesn't have the energy, so to speak, to walk. It sounds silly, but if you're not getting blood flow, the tissues cannot heal fast enough to even walk a couple blocks. So he has to do as little as he can to exhaust as little energy as he can so that he can actually get from point A to point B.
If you were advising Deion Sanders as it pertains to his current status with the blood clots, what would you advise him if he were your client?
Yeah, it's a good question. So obviously he has some genetic variants that he, there's only so much he can do with, but he sounds like he's had really good medical care. I think his first care was at the University of Wisconsin, and just staying up to date on what his body is doing, make sure his blood is thin as much as it can be so that he doesn't develop clots, and know what the abnormal signs are and be really aggressive when he does feel them. He can't wait 2, 3, 4 days because that might translate to a significant issue that may be irreversible, kind of like his toe was. So, he has to really be cognizant of his body and have his medical team, unfortunately, readily available, because he is a high risk, patient for himself. But I think once he gets back to normal, or as close as he can, I think he can live semi-normal life, but he just has to be really cognizant and careful of what's going on, and avoid some of the risk factors. I don't think he's a smoker, but definitely not smoking. There's certain medications he should probably avoid, and just being cognizant of what can make his situation worse.
You can follow Dr. Morse on social media at Dr. Jesse Morse. Dr. Morse, thank you for giving me some of your time.
My pleasure. Thank you very much for having me.